Have you ever seen someone bullied for their body and image? I'm sure we've all seen our fair share of bullies, but do you think the victims want to be obese or skinny? Usually when we see obese or skinny people, we assume that they are not healthy or that they are not trying to be healthy. But did you ever consider that the person could have an eating disorder? It is rare for us as a society to even consider eating disorders until they are brought to our attention by that person. These are questions we should ask ourselves instead of shaming other people for how they look. Today I am here to enlighten you on what an eating disorder is, the three main eating disorders, potential causes for these disorders, and treatment plans. Let's start off with what is an eating disorder. Eating disorders are described as a mental illness that disturbs someone's eating behaviors, emotions, and thoughts. These disorders can cause those affected to be preoccupied with their body shape, weight, size, food, and opinions from others. Eating disorders are commonly mistaken to be a lifestyle choice. The three main eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. First, let's start off with anorexia. Anorexia is a condition that causes people to avoid food, eat little to no food, or restrict their food. There are also two subtypes to this disorder: restrictive anorexia and binge purge anorexia. Restricted anorexia is where the food is severely restricted depending on the type and the amount there is. And then binge purge anorexia is where people restrict the food, but they can also have binge episodes followed by purging. Some symptoms to anorexia include extreme emaciation, intense fear of gaining weight, extreme dieting or reduced eating, osteopenia, I probably said that wrong, but it's thinning of bones, damaged structure and function of the heart, infertility, lethargy. There's more symptoms, but those are some of the common ones. This disorder causes people to fear weight gain so much that they avoid necessary nutrients to sustain the body. The nutrients we eat from food are pretty important, and with anorexia, if you avoid all those nutrients, your body will slowly break down. According to the National Institute of Mental Health, anorexia nervosa can be fatal and has a high mortality rate compared to other mental disorders. Also, according to the textbook Fundamentals of Abnormal Psychology, 10th edition, although most people with the disorder recover, as many as 6% of them become so seriously ill that they die, usually from medical problems brought about by starvation or from suicide. Next, let's talk about bulimia. Bulimia nervosa is a condition where people have episodes of eating unusual, enormous amounts of food. Once they finish binging, they engage in compensatory behaviors such as fasting, purging, or attempting extreme exercises to lose weight. Most of these people feel shame, self-doubt, guilt, and depression, but these can lead to compensatory behaviors. Some symptoms of bulimia include sore or inflamed throat from vomiting, swollen salivary glands from vomiting, gastrointestinal problems, dehydration, and electrolyte imbalance. These are just the common symptoms, not all of them, of course. Binge eating disorder. Now, this disorder is similar to bulimia, but typically these people don't have any control over their binge episodes. They have feelings of shame, self-doubt, guilt, and depression, but they just don't engage in the compensatory behaviors afterwards. Those with this disorder tend to be overweight or obese due to the uncontrollable binges. Some symptoms of binge eating disorder include fast eating during binges, just eating fast, eating beyond what you know is full, eating out of sight to avoid embarrassment of others, frequently dieting, or eating when full or not hungry. Alright, next let's talk about the causes of these eating disorders. Everyone is susceptible to eating disorders. Eating disorders appear more frequently during young adulthood or teen years. There's a strong biological factor for eating disorders as it runs in families. According to the textbook Fundamentals of Abnormal Psychology, 10th edition, if one identical twin has anorexia nervosa, the other twin also develops the disorder in as many as 70% of cases. In contrast, the rate for fraternal twins who are genetically less similar is 20%. People who have eating disorders have a higher risk of suicide and medical issues. These people are also at risk for other disorders, such as depression, anxiety, body dysmorphic disorder, and substance use. For example, someone who may have an eating disorder may eventually develop body dysmorphic disorder. Body dysmorphic disorder is a disorder that causes people to be constantly worried about their appearance, image, or weight. These two are highly comorbid as one can directly lead to another. There are also some societal factors that play a role in causing eating disorders. Eating disorders tend to be more common in young women. This is because of the expectations of women in society. For example, some advertisements use models, but these models on television are usually edited to look thinner. People see these ads and will expect that out of women in everyday society, but it is humanly impossible to be that thin. This causes women to body shame themselves, compare themselves, lose weight, and unfortunately develop eating disorders. This bar graph from the textbook Fundamentals of Abnormal Psychology, 10th edition, is the results of a survey in 2022 for teens that display eating patterns. Right away, you can see a dispersed set of percentages, but the one that should stand out to you the most is the bottom one that says have poor knowledge of nutrition needs. This bar being the highest should cause concern because these teens try these weight loss methods but have no idea what harm they are causing to themselves. The first two bars at the top include teens that skip breakfast and lunch. These two bars being at 50% and 17% show how many teens are trying to lose weight. The lowest bars are the healthy options for teens that eat proper fruit and vegetables. 2 and 9% are bad because the rest of the teens are not getting the nutrients they need from fruits and vegetables. These next two bars could be a cause of obesity. 34% of teens eat fast food every day, and 61% eat some snacks each day. This bar graph shows that teens either lack the knowledge of nutrition or are influenced by the media to lose weight, especially in those fasting bars. Next, we're going to talk about some treatment plans. It is possible to completely recover from an eating disorder. However, there must be early intervention or early treatment. There are some treatment plans that can assist in recovery. One of them is the most famous cognitive behavioral therapy, or CBT, treatment. This kind of therapy helps the person identify unhelpful thinking and recognize or change inaccurate beliefs. For example, if someone has anorexia, they may think that they constantly need to lose weight. What cognitive behavioral therapy will do is help them learn that they are not overweight or obese and that they actually need to eat for the nutrients. It helps them see the problem because people with eating disorders do not usually realize that they have this disorder. Self-monitoring. This requires you to keep a log of what you have eaten and fluid intake. They may ask for any forms of exercise, purging, or binging. You must record the emotions you felt during each event as well. This can prove to be helpful because it will show the road bumps and where someone may need to make a change in their diet. Nutrition counseling. This form of therapy helps treat brain imbalances through supplements and dieting. This can prove helpful when trying to lose weight efficiently without doing extreme dieting or exercises. Medications. Some medications, such as mood stabilizers, antidepressants, or antipsychotics, can assist with eating disorders and other comorbid disorders. And that is it for this video. I hope you guys enjoyed and have learned a lot about eating disorders.